said. So I think that an important thing to ask the secretary is, has he been ever briefed by a CDC expert on anything, specifically measles, COVID-19, flu? I think that people should ask him that in that hearing.
What would the answer
That's
to
number
that
one.
be?
So the answer is no. So no one from my center has ever briefed him on any of those topics.
Really?
So I don't know where he's getting his, really.
No one has ever briefed him on any of those issues that you just mentioned there, including measles, given the outbreak in the United States right now?
He's getting information from somewhere. Yeah, he's getting information from somewhere, but that information is not coming from CDC experts, who really are the world's experts in this area. Like, folks from around the world call us with questions around these infections.
There is turmoil at the Centers for Disease Control, which was always to be expected once Robert F. Kennedy Jr., who is not a doctor nor a scientist, was made the Secretary of Health and Human Services. But it's now been revealed that things are so much worse than they could have been reasonably expected to be. Okay, so I say that, but how often do we get these bombshell reports these days that are just like, yeah, of course that happened, or in this case, like, yeah, of course that didn't happen. So let's hear more from Dr. Demetre Daskalakis, the now former director of the National Center for Immunization and Respiratory Diseases at the CDC.
CDC is the preeminent public health organization, I'm going to say, in the world. And he's not taking us up on several offers to brief him on these very important topics.
Why do you think
Now,
that is?
On the issue, I don't know the answer. Perhaps he has alternate experts that he may trust more than the experts at CDC that the rest of the world regards as the best scientists in the areas. But back to the question, I had for my entire career been an advocate for the LGBTQ community through my work in HIV, through my work in MPOX. I find it outrageous that this administration is trying to erase transgender people. I very specifically used the term pregnant people and very specifically added my pronouns at the end of my resignation letter to make the point that I am defying this terrible strategy at trying to erase people and not allowing them to express their identities. So I accept the note from the press secretary and counter that with, I don't care.
So last week, the CDC laid off 100 staff members who were focused on preventing violence, and they did this just 2 weeks after a gunman targeted the CDC headquarters, killing a DeKalb County police officer, David Rose. The layoffs were part of the agency's overall goal of laying off 1,000 employees. Earlier this week, several senior officials quit the agency unexpectedly in response to RFK's politicization of the work the CDC does and the threats from the administration to pull the COVID vaccine from shelves within just a few months, just as we head into the very vulnerable winter season. The former officials stated that RFK's leadership, quote, will result in death and disability of vulnerable children and adults. On Wednesday, Dr. Susan Montaraz may or may not have been fired from her position as director of the CDC. The HHS account tweeted that she had been let go. Montaraz responded via her legal team, stating that she had not actually been fired and that she has not and will not resign from her position. The White House later confirmed that yes, she had been terminated, but Montaraz maintains that only the president can fire her and he has not yet done so. But following all of the chaos and confusion surrounding Montaraz and whether or not she is still the agency's director, several other top leaders announced their resignations. They included Dr. Demetre Daskalakis, who we heard from earlier, also DC's Chief Medical Officer, Dr. Deborah Oury, the director of the National Center for Emerging and Zoonotic Infectious Diseases, Dr. Daniel Jernigan, and the director of the Office of Public Health Data, Surveillance, and Technology, Dr. Jen Layden. So here is some of what Daskalakis had to say as he departed. The recent term of reference for the COVID vaccine work group created by this ACIP puts people of dubious intent and more dubious scientific rigor in charge of recommending vaccine policy to a director hamstrung and sidelined by an authoritarian leader. Their desire to please a political base will result in death and disability of vulnerable children and adults. Their their base should be the people they serve, not a political voting bloc. I find that the views he and his staff have shared challenge my ability to continue in my current role at the agency and in the service of the health of the American people. Enough is enough. Daskalakis said that the CDC's new COVID vaccine working group, which recently appointed another vaccine skeptic, puts people of dubious intent and more dubious scientific rigor in charge of recommending vaccine policy to a director hamstrung and sidelined by an authoritarian leader, and his impassioned letter said that the CDC was being treated as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health. The recent change in the adult and children's immunization schedule threatened the lives of the youngest Americans and pregnant people. He added, having worked in local and national public health for years, I have never experienced such radical non-transparency, nor have I seen such unskilled manipulation of data to achieve a political end rather than the good of the American people. But back to the CNN interview with Daskalakis, his admission that no one at the CDC has briefed RFK on anything is both shocking and also not shocking. It's shocking at face value, but it's not, because why would someone like RFK even be briefed on something like infectious diseases? He doesn't understand the science behind any of it. He doesn't care about the science behind any of it. He doesn't understand how vaccines work. He doesn't respect actual scientists or doctors. What could they possibly say to him that he would either understand or honor? The thing is, though, that's not the point of any of this. RFK was not installed as the HHS secretary because he's so good at health and human services. He is there to push a political agenda. He's there to not get in Donald Trump's way. He's there to do the work of ridding the agency of qualified people and replacing them with loyalists who will, again, not get in the way of the Trump administration or its political agenda. The thing this country doesn't seem to understand, and I'm talking more about the voting public rather than the elected officials, is that some things transcend a political agenda. Health and science are among those things, but when people don't know who or what to trust anymore, when experts have been discredited by non-experts, when conspiracy theories are more comforting to people than provable evidence, and when facts don't have feelings, but feelings still dominate the political rhetoric because they're easier to manipulate than facts are, then we start to see the dismantling of institutions that were put in place in the first place specifically to aid the public. And I'm not trying to say that the CDC is now or has ever been perfect or even perfectly apolitical. It's natural that some politicization would seep into any government institution. But if you have the right people in positions of authority and influence, then you at least stand a much better chance of the science ultimately prevailing. Unfortunately, we no longer have those people in place, and that is by design. These people, these doctors, resigned because that was always the intended outcome. So as of now, the CDC is defunct, and we as a country are all worse off for it, all right? That's it for me. If you got anything out of this, please like the video and subscribe to the channel for more. Thanks.